Welcome back. In this video, we're going to explore role-playing exercises, interactive scenarios designed to simulate real-life situations where you can apply treatment techniques for managing depression. Role-playing is an excellent way to practice your assessment, communication, and treatment planning skills, while also building confidence in applying your knowledge in real-world situations. Why is role-playing important in treatment applications? Role-playing offers a safe, structured environment where you can practice responding to real-life scenarios. It's a great way to improve communication skills, practicing how to talk with patients about sensitive topics like depression, suicidal ideation, and treatment resistance. Assessment techniques: simulating how to assess depression severity, risk of suicide, and comorbid conditions. Treatment application: learning how to develop and implement treatment plans based on the patient's unique needs. By acting out real-life cases, you gain a deeper understanding of how to apply treatment strategies and how to approach complex patient interactions. Let's start with our first scenario. Scenario 1. Managing a new patient with mild depression. In this role-play, you'll be assuming the role of a healthcare provider, and the patient, David, is a 28-year-old man presenting with mild depression. David reports feeling down and unmotivated, but he hasn't sought treatment before. His symptoms include low energy, difficulty concentrating, and trouble sleeping. Step 1. Building rapport and initial assessment. The first step in treating David is to build rapport. Start by introducing yourself and asking David some open-ended questions to make him feel comfortable. Can you tell me more about how you've been feeling lately? When did you first notice these symptoms? And how have they been affecting your daily life? Make sure you listen actively and show empathy to create a safe space for David to open up. After gathering initial information, it's important to assess the severity of his depression. You might use the PHQ-9 screening tool to evaluate his symptoms more objectively. Step 2. Developing a treatment plan. Next, you'll need to develop a treatment plan tailored to David's needs. Since his depression is mild, the treatment plan might include psychotherapy. Recommend cognitive behavioral therapy, CBT, as it is an evidence-based treatment for mild depression. Encourage David to attend therapy sessions weekly and focus on addressing negative thought patterns and developing healthier coping mechanisms. Medication. Since David has mild depression, you may not need to start with medication right away. Instead, discuss lifestyle changes like regular exercise, better sleep hygiene, and stress management to help manage his symptoms. Follow-up care. Schedule a follow-up appointment in 4 to 6 weeks to assess David's progress and ensure that he's engaged in therapy and applying the strategies he's learned. Step 3. Monitor for warning signs. In the role play, you should also discuss warning signs of worsening depression. Encourage David to reach out if his symptoms worsen or if he begins experiencing thoughts of self-harm or suicidal ideation. It's important to ensure that David knows he can contact you or a support person if needed. Reflection questions. How do you build rapport with a patient like David to ensure he feels comfortable discussing his symptoms? What is the role of CBT in treating mild depression, and why is it a good first-line treatment? Let's move on to the next scenario. Scenario 2. Managing a patient with treatment-resistant depression. In this role play, you'll be assuming the role of a healthcare provider, and the patient, Sarah, is a 33-year-old woman who has been experiencing severe depression for the past year. Despite trying SSRIs and cognitive behavioral therapy, CBT, she has seen minimal improvement in her symptoms. Sarah reports feelings of hopelessness, low energy, and difficulty concentrating, and she is finding it hard to engage in her daily activities. Step 1. Reassessing the diagnosis. The first step in this scenario is to reassess the diagnosis. Ask Sarah, how has your depression been affecting your daily life? Are there any other factors like stressors or medical issues that might be contributing to your symptoms? Since Sarah is treatment resistant, It's important to explore whether her depression might be linked to other conditions, such as bipolar disorder or generalized anxiety disorder, which could complicate treatment. Step 2. Adjusting the treatment plan. Given that Sarah's depression hasn't responded to SSRIs and CBT, the next step is to adjust the treatment plan. Medication. Adjustment. Consider switching Sarah to a different class of antidepressants, such as SNRIs or MAOIs, or add an adjunctive treatment like mood stabilizers or antipsychotics to address her symptoms more effectively. Advanced treatments. Discuss advanced treatment options like electroconvulsive therapy, ECT, or transcranial magnetic stimulation, TMS, if Sarah's depression is severe and resistant to medication and therapy. Continued therapy. In addition to adjusting medication, continue therapy, perhaps adding a more intensive approach like dialectical behavior therapy, DBT, which can be effective for treatment-resistant depression. Step 3. Ongoing monitoring. For Sarah, it's critical to schedule more frequent follow-up visits every 2 to 4 weeks to monitor her response to the new treatment regimen and adjust as necessary. Regular check-ins are crucial for managing treatment-resistant depression. Reflection questions. What are the steps you would take to reassess the diagnosis and treatment plan for a patient with treatment-resistant depression? How would you explain advanced treatments like ECT or TMS to a patient like Sarah? Role-playing is an incredibly powerful tool for enhancing your clinical skills and improving your ability to apply treatment strategies in a variety of situations. In these role-play scenarios, we worked through how to approach patients with mild depression, treatment-resistant depression, and ongoing challenges in managing symptoms. By practicing these scenarios, you can build confidence in your ability to handle real-world cases effectively. I hope you've learned something from this course. Thanks for watching.